everybody, I'm Lee Cade, and this is VINI. Today, we're doing a spotlight on some community partners we have here. Now, it doesn't get any more community partner-ish than Salt Lake County. So today, we'll be talking with two people with the Salt Lake County Health Department, Jorge Mendez and William Peterson, and they're part of a program that a lot of you probably haven't even heard about. Now, there are some people here at Valley Behavioral Health who know a lot about the Q&I initiative, but for most of you, this is probably a brand new thing. So first off, let's talk with Jorge Mendez about what the Q&I initiative is. I hadn't even heard about this prior to being introduced to you about 2 months ago. What is the Q&I initiative?
First of all, thank you for having us. Great that we're able to discuss about the Q&I initiative that started almost simultaneously as the pandemic hit. As you know, we're in the middle of the pandemic. And of course, now we have great news that vaccines are available and that vaccination rollout is going great. And many of us have had the opportunity to receive vaccines. But at the very start, there was a lot of confusion. There was a lot of questions regarding what to do about COVID and the COVID pandemic that was gripping around the world, especially here in the United States, when numbers started to climb back in 2020. February of 2020 is when we started thinking about what to do with the recommendation from the CDC, Center for Disease Control and Prevention, about the importance of isolation or quarantining if we had known contact with somebody else who was infected with the virus, the importance about quarantining to prevent the spread of COVID-19 amongst the community and or family members or other members in the household. And of course, isolation, which is the importance of staying away from other individuals, especially those who are most vulnerable to infection, who have a weaker immune system or who have underlying conditions or comorbidities that make them more prone to the worst symptoms of COVID-19. So isolation would be a place where you would be either in a secluded room, access to a restroom, and not expose anyone else to the virus. So the concept of Q&I, or quarantine and isolation, came about. And what could we do as a county to implement or make it easier for folks who didn't have access to a place to quarantine or isolate more accessible? So we started putting our minds together and identified a few facilities. We thought about the hotel industry, as other states in the country have utilized. For us to move quickly and implement Q&I, we selected a few sites, a few properties that the county had, and turned those into quarantine and isolation sites. So sure enough, many clients started trickling in, mostly from our community, the homeless community, individuals who are experiencing homelessness, who were infected with COVID-19, had a place for them to get better, to get well, for them to be provided with food, with safety, with essential medical needs, and if needed, transportation, emergency transportation to a hospital if some of the complications came about. So that's how it started.
Well, I remember thinking when COVID-19 first hit, thinking how devastating COVID could be for the unsheltered population, because this is a very vulnerable population that a viral transmission could be it could spread like wildfire too. So being able to isolate, like you're saying, quarantine and isolate folks who did end up positive is amazing. I think it's amazing that we're able to roll out that quickly. Now, William, in your situation, you weren't part of the health department, were you?
No, I have a theater degree. Nothing science-based at all. Yeah.
And COVID comes along, and you're working where now?
Actually, I worked for a dance company before COVID hits, and they shut down, of course. But my county connection was working for the arts and culture departments at the theaters downtown, Rose Wagner, the Eccles, Ravenel Hall. And back in April of 2020, I got an email from my supervisor saying that health department was swamped and needed as much help as they could get from all departments. And I thought, well, it's either stay home, play video games, or get to work and help out a little bit. So I signed up, got some training, and ended up it was going to be a transport originally, but decided I better utilize my stage manager, technical director abilities, and as a coordinator role for Q&I shelter, which at the time was some county-owned property. And, I stuck it out, and now I am the Q&I manager over our remaining property, and been in this capacity for about 2 months. Previous to that was assistant manager, and kind of can't get away from helping out in some way. So
now, anybody who's managed any kind of theatrical production or has been involved in a theatrical production knows that a stage manager can do just about what you just mentioned. So I'm not surprised. that you were able to step into that role.
And William has been a great asset to this initiative. And there's been several that have rose to the top, and we definitely cannot do without. And you were correct. The health department, we were spread so thin. We started reaching out to other sectors in the county. Parks and Rec, culture and arts definitely came through for us and have been amazing so far since the start of the pandemic. I've known William. I met him back at one of our other Q&As that we had a different location, different setup, different approach. We had some challenges that we overcame together, and here we are. William is now dealing with our single one site, which is a hotel structure where we house all those individuals who are experiencing COVID or infected with COVID.
Now, that's got to be quite an undertaking now to be able to stage this kind of an operation where people can overcome this virus with some dignity and some autonomy, for one thing. How much does this take? Are you working with community partners, or is this solely a county undertaking?
It started as a county undertaking. Of course, we quickly created some of the partnerships, many of which we had prior to COVID-19, as we better understood how COVID spread and how quickly it can spread really in congregate settings, such as homeless shelters. We really created a bond with this institution's system here in Salt Lake County. 4th Street Clinic, for example, has been a key component for us to rely on to provide some of the medical services testing, for example, for congregate settings. And we rely on them to refer many of the clients, not just them, but also the HRCs and, as I said, the hospitals, systems that as soon as they have individuals who they have been tending to at the hospital, once they are able to be released, but not outside of their isolation period, they are referred to us and they are transported to our site where we care for them for the duration until they complete their isolation or quarantine.
Now, William, how long of a period are we talking about? If somebody is referred to your Q&I shelter, are we looking at 3-4 days, a week, 2 weeks?
Yeah, a lot of that depends on their status, the COVID status, if they've tested positive or negative, or if they've been exposed to someone who has had COVID. Those all factor into their length of stay. Currently, we've been accepting clients who are either awaiting test results or have had a result come back as positive. They're waiting for results. In the early days, it took a couple of days, right? Because the testing results the process getting those results in wasn't quite as streamlined as it is now. Nowadays, we'll have clients who could be there for less than a day or a day or two if they come back as negative. They're positive. Generally, it's going to be 10 days from the date of their first exposure or from the date their symptoms started. But of course, there's a lot of factors. If you have a family involved, different people test positive at different times, which necessitates different periods of isolation and quarantine. And so it all, it's generally most people stay with us for, I'd say, 7 to 10 days.
Wow, that's absolutely staggering. With this program now going on for a little bit over a year, now we're seeing a stronger efficacy with the various vaccines that have been going on. Do you guys see this program going on much longer, or is this something that's going to be phased out?
We've been discussing that very question. Ideally, we would not have a job. COVID would die out entirely, but we do know that COVID is going to be around in some form for years to come. We may not ever get rid of it. So there has to be sort of a long-term strategy that is more sustainable than a separate Q&I facility. So we intend to be involved with helping folks at the quarantine and isolation to some degree for quite a while. As far as the setup is concerned, it might be a couple more months. It's really hard to say how long this facility will last. We're looking at the data of how many clients we're having, the positivity rates in the community, and also the vaccination rates in our population. And all those factor in to become one giant unanswerable question. But clearly our primary concern in Salt Lake County is making sure that we are helping our community partners however we are able to, helping take care of their clients and their needs while still providing opportunity for people to be set up in a way that's going to be a long-term sustainable approach.
The only thing I would add is that with the advent of the variants, as they have been in the news all over, there's these COVID variants coming from different places around the world, and some of the issues with that is we anticipate that these COVID strains may linger in the community for months to come. We know that there's always going to be folks who would be exposed to the infection, and we will continue educating and providing some type of assistance as to how to best quarantine and isolate as needed, either working closely with the partners we currently are working with to isolate, quarantine on site, or provide other means of quarantine and isolation once we no longer have a centralized location for Q&A.
Now, I know, like our organization, Valley Behavioral Health, we've had some of our people from our Homeless Outreach Center helping out and working with your Q&A group, but there's got to be a way that people in the community can either pitch in or help out in some way, shape, or form. Is there a way people can help out or give back to the community? Because this is one Herculean effort you folks have put on here and helped out in the community, and it's largely invisible at this point when you think about it. Like, if we weren't talking about this right now, I don't think that the close to 1,000 people that are going to hear about this next week would even know about it. You're largely unsung and unseen. Is there a way that the people that are hearing about this can give back and help out in some way?
Many have come through. Many have provided assistance over the months. I remember at the beginning of the pandemic, at the start of our Q&A initiative, many folks in the community, from church groups to community-based organizations, provided their help, assistance. Of course, because of safety situations, we couldn't allow them to work inside or within the logistical aspects of Q&A, but they provided blankets, clothing. In fact, it was even during, and I'm talking about months after last March 2020, almost every month, community-based organizations have assisted with Q&A through donations. We are now morphed that community sort of approach to education and awareness, providing education on how to properly quarantine, what means to quarantine. And that's changed. It's been a moving target, right? As you know, CDC has changed from time to time the stance of what Q&A means, but that information is spread in the community. The better off folks are knowing how to do it effectively and limit the spread of a community spread of the virus. Most recently, during Christmas time, I remember we put out a request for some gifts for some of the families with children that were in Q&A. And they came through. So many gifts arrived. And if you want to speak to that, William, I think you lived it. You were there.
Yeah, it's a whole room full of wrapped gifts that were just brought in. We were blown away. We've had a lot of nursing students help out as well from local college, help us with part of their studies. Involves, nursing practices and procedures. And so they're able to help out in the COVID response as well. And they also solicited donations from their friends and their peers. And a lot of people just come through in really critical moments to just help make people's time in quarantine a little better. No one wants to be in a hotel room by themselves, right? And we've read what we can in terms of entertainment with books and televisions and an outdoor area where they can just enjoy some sunshine or some snow or whatever the case may be in Utah weather.
Right.
Can't tell. And so we've had a lot of people reach out specifically to ask, hey, what can I provide? Can I bring some? We had elementary schools write cards, and they delivered cards to people that have been here. We've had people just deliver photos and little craft kits and Thanksgiving turkeys that they can kind of decorate and help make it a little more special. So yeah, we've had a really great response from the community in terms of helping the clients feel a little bit more comfortable and have a little easier time.
Right. One thing that we need is we're battling misinformation that is spreading about the vaccine, for example, and many of these theories about the dangers with the vaccine. Of course, there's always issues that come about, namely Johnson & Johnson and the issues that arose where 6 individuals amongst millions who have received that vaccine have experienced some clotting. But there are so much misinformation out there about the vaccine that it is perhaps the one thing that we would ask the public to help us out with, to talk it amongst friends, family members, neighbors. Sometimes they are the trusted voices that often folks pay attention to more so than the health department or the state health department or the CDC, the Center for Disease Control and Prevention. So if you help us out with this, battling misinformation, providing the right information, going through the proper channels, and understand that the vaccine is effective. And there's far worse effects if you are infected with COVID-19 than you could possibly have with getting vaccinated.
I did want to add some appreciation for Valley Behavioral Health. I remember back in May of last year, getting the iPads from Valley Behavioral set up, doing some test runs with your IT team to get that resource available for our clients. A lot of people just don't have access to those resources outside, and having them in the shelter, someone to talk to, because it's very mentally taxing. Even the stress of thinking about having COVID, especially in the early days when people didn't know really what that meant. There's a lot of unknown questions, and the security of having a trained mental health professional available has been incredible. And in the last few months, we've added some in-person Valley Behavioral Health visits and partnerships with some key members of your staff. So they have been an invaluable resource and have come out, early in the morning or late at night to talk to some clients who are having a really, really hard time. And they've really enabled us to be able to provide the service to as many people as we can. I'm not a mental health professional. Right, I work in theater, as said earlier. None of my staff are. We're all come from different areas, different backgrounds. And so there comes a time when we feel inadequate to serve people the best way we can. But having a resource like Valley Behavioral on site really helped reassure us and reassure the clients that they are being looked after and cared for. And so it's been a very key partnership, particularly these last few months. Just want to add that in there as a thank you. Oh,
that's awesome. I know that our team has been happy to be involved, and it's just great to know that your team has been so hard at work, and especially getting to know the two of you guys over the last half hour or so, and seeing the hard work that you've been doing. And I say this from the bottom of my heart. I hope to see you out of work soon.
We hope so too.
Absolutely. Jorge, Mendez, William Peterson, thank you so much for taking the time to talk with us today.
Thank you, Lee. Appreciate it.
Awesome. Thank you very much.